In my role as medical director at different residential and detox treatment facilities here in Southern California, my goal is to bring the absolute highest level, best standard of care to patients in a wide variety of settings. We use protocols to ensure that we're using evidence-based science and medicine and to ensure that we're delivering really safe care. We also do it in a way that's individualized to each patient so that the patients are comfortable and safe and also awake and able to fully engage in all of the programming that a setting has to offer. I bring not only my personal experience, but also a wealth of knowledge from a very extensive background. I trained in both family medicine and psychiatry, and so I'm able to bring in both my medical knowledge and also an incredibly deep respect for the importance of the therapy work that's done in the residential treatment setting. I'm always looking to work with the therapy team in order to make sure that the medication that we're using for detox or for treatment, of course, is never interfering with the therapy process, and ideally is actually helping and augmenting the therapy process to make sure that they're getting the most out of their stay, whether it's for just a few days or even up to a month or 2 months. It's very important to me to participate in treatment team meetings so that I'm accessible to the therapists, to the techs, to the nurses, to make sure that if there's any clinical questions that come up, we can answer them as quickly as possible. I personally train and work very close with the different providers that I have on staff, ranging from physicians to nurse practitioners and physician assistants. When one of my providers is meeting with a patient at a facility, it's as though the patient is meeting with me, myself, so that our standard of care is very much uniform and accessible to all of the patients, no matter who they're seeing.